digesting what was a fantastic and delicious food. But I think what we have in front of us, it's a very, very important agenda. So if you can make sure that you are concentrated and hear what the speakers have to say today, because it's important that we make change and action on long-term care. So the session is entitled Ensuring Access to Long-Term Care and Support for Care Workers. And I have with me, and I will introduce them later, but just to mention their name, we have from my right to the left, we have Stacy, we have Ernst, we have Vincenzo, we have Claudia, and we have Maria. So they will be part of the panel, but allow me just to say a few words of introduction. And I will start by really looking back at what happened, what we have lived in the past 2.5 to 3 years, the reason why we have not seen in person or talked to each other really on a contact basis in the past months and years, which is the COVID-19 pandemic. And as you know, the impact of COVID-19 has been devastating on the long-term care sector. And I repeat it has been really devastating. And in a way, it's a revealer, it's an eye-opener, something that we must reflect upon to think, how do we make sure that this does not happen any longer? How do we make sure that we make the changes which are needed for improving the conditions of older people and the carers? Now, just to highlight some of the things that happened during the pandemic, but obviously you know all of that, but more than 90% of the people that died were aged 60 and over. And in the long-term care sectors, those are data only for the institutional care sectors, the number of people that died represent 40% of all the deaths in the pandemic. And we've seen also lots of problems, lack, for example, of standards of care. Only half of the countries that I work with at OECD, I'm heading the work on health at OECD, but only half of the countries really had guidelines on infections control, for example. So really quite something that makes us think, well, we were just not ready and prepared. And quite clearly that has to do with a lot of structural and issues and problems and deeply rooted structural weaknesses that existed already into the sector. And I would like to describe them maybe as the sort of the low and the high. The low pay, for example, the low image of and the poor image that the sector has, the issue of low standards for the jobs into the sector, the high risk that are associated with caring both for physical and for mental health, the high turnover that we see in the sector. And all of those, if we can also touch some numbers to them, and they're really quite scaring. If you look at low pay, for example, looking at people with equal qualifications as care workers, on average across the OECD, they are paid per hour 9 euros per hour. And this compares, if we look at similar type of jobs in the hospital sector, to something like 14 euros. So for the same type of jobs, people are just paid dramatically different depending on whether they are in the elderly care sector or in the hospital care sectors. If you look at another thing which I said, there are low standards for the quality of jobs. Some 40% of long-term care workers work part-time, and it's about double what we find in the economy. Very often with contracts which are not open-ended, they are fixed terms with conditions, therefore, which are not comparable to what we find in other sectors. And if we look at things like the high, in terms, for example, of the high risk for the sector, we find that 2/3 of long-term care workers suffer from physical risk factors, which exacerbate their overall health. So quite clearly the sector has issues, and I'll describe them as the low and the high, and clearly that requires policies. We know what those policies are: better training, better retentions, raising the profile, raising the pay, and so forth. The other part of the sector is really to do with the informal care workers. So that's the family, the friends, which actually really constitute, and it has been said already, the backbone of the systems. They provide about 2/3 of the care which is supplied into the sectors. And they are very much often women that have this job, and that contributes also to a sort of cycle of inequalities also between gender inequalities and caring jobs. Of course, also the informal carers are predominantly women. If we look over time, we have known these issues for quite a long time, for more than decades, and there's been some improvements, particularly in making respite care more available to care workers. But when we took a wider policies to support the informal carers in terms of training, psychological support, financial compensation for their caring, and policies that allow them to continue to participate in the labor market while having caring responsibility in a way that does not reduce or their overarching health, both physical and mental, well, we're very much lacking behind. And so quite clearly we need to make much more fundamental changes for the future. And I just would like to highlight three changes that for me are quite important. The first one has to do really with some sort of a cultural shift, I would say. We need to really look differently at the long-term care center. The image is just not helping in addressing those problems in the labor market for care that I alluded to. And quite clearly also the way we see the older person, the image that we have to that is not a burden of society, but also in terms of the caring jobs themselves. They're almost considered as the last job that one person choose from. So we must change, have the cultural shift, which has to do probably not with us. We all are preaching to the converted in a way, but the wider society. So how do we do that cultural shift? Secondly, we probably need to think much more about resilience into the long-term care sector, and that is directly a response to the pandemic that we have been living. So, of course, we need to think about improving the performance of the long-term care sector in terms of access, in terms of quality, in terms of quality of the jobs and so forth. But we also need to think much, much more and deeply, in deep way, about what does it mean having a sector which is better prepared for a potential shock. It could be a pandemic, it could be a shock of a different nature that come in, but quite clearly we're not ready, and this is not acceptable for the future. So we need to assess much better preparedness in the countries. We need to think about protocols, how they need to be changed, coordination channel between health, long-term care, and wider sectors of the economy to avoid the cascading sort of errors that we have seen, and think much more at how to generate standardized and real-time data to help support decision-making in time of crisis. And the third thing that we need to do is really to think about people-centeredness. So I speak of the organization, we collect lots of data and indicators, and we have all sorts of data and indicators on volumes of care, on number of workers, also on personal cares. We hardly have any data on quality of life and on really outcomes that matters to people, both the care recipients and the care providers. And we must address that, because any policy that we want to implement, whether it's to improve the quality of the jobs, whether it is to address the issues that informal carers face, needs to have in mind the ultimate goal of how are we improving the quality of life, the people-centeredness, and the also outcomes reported by the individuals themselves. And if we put that at the center of our policy and make sure that our policies are geared towards that, then it becomes more natural to understand that we must train, that we must invest much more into the sector. So those are my initial remarks, but I've spoken too much, and I would like to really give the floor to the real speaker here today, and I'll start, Ernst, with you. Who is going to go on the podium. So Ernst van Koesveld, I hope I pronounce it correctly, is the Vice Minister for Long-Term Care at the Ministry of Health, Welfare and Sports of the Netherlands. And the floor is yours.
Yeah, thank you very much. I'm just testing this microphone. Is it all working? Yeah, great. Thank you for the hands up. It may be a truth as old as the road to Rome that nobody really wants to be old, but maybe everyone wants to grow old in a healthy and active manner with dignity. That is one of the conclusions I often draw if I talk to people, and I think that may also be relevant for you. What I learned from the first session this morning is that talking about support and care for all the people should be part of a discussion in society. And it is a discussion about reciprocity. The potential of all the people is huge, with their wisdom and experience and time. And on the other hand, their appeal, their call upon society is huge in terms of the need for support and care. And that very much relates also with a call on the labor market, where we have already a lot of challenges in terms of scarcities, of shortages on the labor market. So I will tell you a bit more on our major challenge, which is actually combining the huge demands we have with aging of the populations on the one hand, and the shrinking labor market, or at least shrinking also the informal healthcare players. And let me tell you a bit more about our perspective, which I think is a common perspective for many of the countries here, but maybe not for all, but it may be a future perspective for the other countries as well. I do that by presenting a SWOT analysis very briefly. The strength of our system in the Netherlands is that we have defined together with all major stakeholders, professionals, client organizations, insurance companies and others, how to define quality in long-term healthcare, particularly the quality in nursing homes. And that was a collaborative effort together, guided by the government, and also a basis for the funding from the government for the long-term care sector. And that is a process of learning by doing, evaluating and learning again, improving the quality, not only on paper, but particularly in practice. The weakness, to be honest, of our system is that our sector is very institutionalized. About 30 years ago, about 30% of all people above 80 lived in a residential home, in a nursing home. Nowadays, that percentage is about 13%, so that is already a major change. But if we compare the Netherlands with other countries in Europe, our degree of institutionalization is still very high. And that also relates that we have a shortage of housing opportunities for people that want to live in their own home, or at least together with other older people in cluster settings. We have scarcity, shortages in propositions on that account. We have a major threat, as I already told you, with a population which is not really growing, and the labor supply is not growing either. At this moment, 1 in 6 or 7 people in the labor supply work in the healthcare sector. If you just follow the projections over the next decades, that ratio will be 1 in 3. So could you imagine that suppose you were all working in the Netherlands, part of labor supply, then one of your neighbors or yourself would be working in the healthcare sector in 2040, and that's simply not sustainable because we have major other challenges in terms of environment policies, defense, education, and so on and so forth. So given that challenge, we have to organize things in a different way, because going forward, it must be done in a more intelligent way. And part of that solution is to rely more on what people themselves can do, together with the informal caregivers, but also to make use of innovation, which reduces the pressure on professionals, may activate people, both in a physical and mental sense, and will reduce administrative burden, which can then be freed for providing care itself. So if you compare the situation of the Netherlands with other countries and you look at expenditures, we have a moderate degree of aging. But if you also look at the long-term spending, which also includes the spending for people with a handicap, then our spending is very high. And as I said, it is not the spending in itself which is the major bottleneck, but the major bottleneck is to find the people to fill the vacancies today and tomorrow. So what is our program? Well, first we have to redefine quality. We have to move from input, as Francesca just said, to more outcomes. What is important for people, for clients themselves, how they value their life, what kind of support and what kind of care do they need, where do they want to live, and what is then needed from others. The second movement we want to do is to have a closer cooperation between professionals and informal care. That means that professionals have to be retrained to really ask people, what is it what you can do yourself? What can an informal caretaker take care of? And how do we work together between formal and informal caregivers? And we have to make use of innovation. We've just been at a seminar in the lunch break about the preventing of falls of older people. And I think technology, having sensors, but also, for example, to have a hip airbag that really blows up once you are falling, can really prevent people from falling, and has actually prevented a lot of hip fractures already in the Netherlands. So we have to make use of all the modern technology. The silver economy, I think many solutions do not come out of the healthcare sector itself, but many times they come from other sectors. Consumer markets will be very helpful in this respect. So our policy with the new program of the new cabinet will imply a programmatic approach to these issues and setting new norms. One norm will be focus on the people's strength of all the people themselves and how they can help also themselves, whereas healthcare should be additional to that. Try to find more places where people can really feel at home, which is not necessarily in nursing homes, but close to their own original home, in settings that are clustered where health can be provided. So rather asking people to go to health care should go to the people themselves. And as I said before, to make use of innovations. So these are the lines that we try to set out with all participants. As we fought against the sea in earlier decades and ages, we now work together with all stakeholders in society to think about tough choices we have to make, because going on the same way is not possible. We have to do it in a different way of organizations. And I hope we will learn from all your experience and share our experience with you during this conference. Thank you very much.
Ernst, thank you so much. And clearly, the Netherlands spends so much more than other countries that your issue is more how do we create much more of an integrated, also with approach with the family carers. But I was intrigued also by your reference to innovations. And you know, if we had the time, I would be tempted to ask how do we make sure that this innovation does not further add to cost, but that really helps to improve the quality. But we don't have time. We need to go to the second speaker, and I'm really delighted to have Monsignor Vincenzo Paglia, who is the president of the Commission for the Reform of the Healthcare and Social Medical Assistance for the Older Person in Italy. And Vincenzo is going to speak in Italian. So if you don't have the headphone, please go and
Spero di portare un po' di fresco con la lingua italiana. Io sono molto lieto di poter partecipare a questo incontro e non vi paia strano che un arcivescovo, per di più presidente della Pontificia Accademia per la Vita della Santa Sede, sia anche presidente di una commissione del governo italiano per la riorganizzazione dell'assistenza agli anziani. Questa commissione nasce di fronte alla contraddizione che la pandemia ha mostrato. Le vittime, come lo diceva anzitutto all'inizio la dottoressa Francesca, le vittime più numerose della pandemia sono stati gli anziani. Non per caso, perché è emersa una contraddizione radicale della nostra società contemporanea. L'Italia, dopo il Giappone, è il secondo paese più anziano del mondo, quindi abbiamo in qualche modo una responsabilità di visione e anche di progettazione. La società in Italia ci fa vivere 20-30 anni in più ed è una grande conquista, ma nello stesso tempo non ci sa mantenere. In effetti, durante la pandemia, le vittime sono state gli anziani, più di 120.000 persone, una vera e propria strage. Di fronte a questo, il governo italiano, in particolare il Ministro della Salute Speranza, mi ha chiesto di presiedere e organizzare una commissione per risolvere o comunque per liberare questa contraddizione della società. Abbiamo fatto un esame, un'analisi per diversi mesi, abbiamo infine presentato i risultati al Presidente del Consiglio Draghi, il quale ha accolto la Commissione, ha creato una nuova cabina di regia interministeriale con ben 12 ministeri, di cui io sono il coordinatore, e che mi auguro nei giorni prossimi diventi legge quadro del governo italiano da presentare al Parlamento per la riorganizzazione dell'intero assetto del popolo anziano. In Italia noi anziani, ultra 65 anni, siamo circa 15 milioni, più di un quarto della popolazione. Ed è un popolo nuovo, una nuova generazione che è nata, ma è come un continente sconosciuto. Su questo nuovo popolo di milioni di persone non c'è pensiero né politico, né economico, né culturale e neppure spirituale, permettetemi di dirlo anche nella mia veste di religioso. E questo ha richiesto un cambio totale di paradigma e a dire che la società italiana, partendo dal governo, dalle amministrazioni e dalle altre istituzioni civili o anche religiose, deve farsi carico dell'intera popolazione. Quindi non è più un'attenzione ad interventi o a prestazioni, ma l'intera società si fa carico della popolazione anziana. E per questo il documento che apre l'intero disegno è costituito da una carta dei diritti degli anziani e dei doveri della società. Abbiamo voluto iscrivere immediatamente questa connessione tra diritti degli anziani e doveri della società. Una carta che non sto qui ora a spiegare, ma la stiamo traducendo in tutte le lingue delle Nazioni Unite per poterla presentare come contributo del governo italiano a tutti i governi per comprendere quanto questa materia richieda un cambio di prospettiva radicale. Una nuova generazione non può essere slegata da tutte le altre generazioni precedenti. Noi è come se vivessimo in questo tempo in un palazzo di 4 piani, immaginando ogni piano per una generazione, ma questo palazzo rischia di non avere né scale né ascensori. Ognuno è per conto suo e tutto questo non può rendere la società umana, responsabile, solidale. Per questo si richiede un cambio culturale profondo e non superficiale. Si tratta davvero di non mettere delle toppe, ma di dover ridisegnare l'intero assetto. E in questo senso la Commissione ha ritenuto come primo compito cruciale che tutti gli anziani restino il più possibile a casa loro. Non possiamo permettere che gli ultimi anni della nostra vita siano anni sradicati dal luogo dove sempre siamo vissuti. In questo la Commissione ha proposto una riorganizzazione della sanità come un continuum assistenziale che parta dal primato dell'abitazione con una ricostruzione di tutto il tessuto relazionale attorno all'anziano, perché è la solitudine il virus peggiore della vecchiaia. Molti sono morti per solitudine, ancor prima che di Covid. Ecco perché è indispensabile ricreare attorno all'anziano a casa un contesto sociale che sta sparendo. Noi viviamo in una società iperindividualista e in una società come questa chi è forte sopravvive, chi è fragile inevitabilmente verrà emarginato o scartato, come ama dire Papa Francesco. E qui faccio una parentesi, permettetemi, perché questo problema riguarda tutte, anche le fedi e le prospettive religiose. E devo dire che Papa Francesco da 3-4 mesi sta continuando a riflettere sul tema della vecchiaia come un tema non di naufragio, come amava dire ad esempio il generale de Gaulle, ma come un tema o come una realtà che sia una ricchezza per i paesi e non semplicemente una spesa. In questo senso è indispensabile, a mio avviso, una vera e propria rivoluzione culturale che comporta quindi all'inizio questa attenzione attorno alla casa dell'anziano. Noi prevediamo nel progetto di legge, ad esempio, che quando un cittadino compie 80 anni venga almeno 1 o 2 volte l'anno visitato da un'equipe medica, infermieri e assistenti sociali, perché non sia lasciato solo e accompagnato. Inoltre prevediamo la crescita del co-housing, aiutare gli anziani soli a realizzare delle piccole convivenze. Devo dire che ad esempio qui a Roma con la comunità di Sant'Egidio ci sono molte esperienze di anziani soli che vivono assieme. C'è poi l'urgenza di istituire, per quel che ci riguarda in Italia, almeno 1000 centri diurni che debbono essere ben attrezzati. 30 anni di vita richiedono anche ambiti per fare scuola. Noi dobbiamo aiutare gli anziani ad alimentarsi, a combattere il caldo quando arriva, a riabilitarsi, a dare loro lezioni, per esempio, di alimentazione e anche di cura del proprio corpo, per prevenire. Uno dei temi gravissimi in Italia è l'intasamento degli ospedali e dei pronti soccorsi degli anziani. Ed è chiaro che bisogna trovare una realizzazione, e vado alla conclusione. C'è poi il tema delle RSA, delle lungodegenze, che vanno ripensate. Noi non vogliamo più avere luoghi appartati e non visitabili come è accaduto in questo tempo di pandemia, perché sono delle vere e proprie reclusioni e noi non possiamo permettercelo. Ecco perché ci auguriamo, noi qui in Italia sappiamo le crisi dei nuclei familiari eccetera eccetera, ma noi ci auguriamo di poter tornare anche a morire nelle nostre case circondato da affetti dei propri cari. È il tema, a mio avviso, in tutto questo contesto, un'occasione straordinaria non solo per aiutare gli anziani, ma anche per aiutare il nostro paese, l'Italia, ma anche gli altri, ad essere più umano. E devo dire che voi potete immaginare che io sono esperto sull'Ave Maria o il Padre Nostro e non tanto su queste questioni mediche, per cui il primo consulente che io ho consultato su questo tema è stato il Ragioniere Generale dello Stato, perché gli ho presentato il programma e gli ho detto: senta, regge o no economicamente? Abbiamo fatto i calcoli e abbiamo notato che non solo la sanità risparmia 6-7 miliardi di lire, di euro, scusate, ma rende la vita degli anziani, dei caregiver e dei familiari o dei piccoli paesi molto più umana. Grazie.
Excellent. Monsignor Paglia, thank you so much. I like the idea of a country which is a super age country taking the responsibilities. Taking the responsibilities really for setting a vision which is made on the rights that each individual has, but also the responsibilities that as a society we have, and this whole of society approach, which is, I think, fundamental one, and you alluded to the importance of really people living at home. Thank you so much. Without further ado, I would like to move on to Claudia Mahler now, who is representative of an independent expert, and in fact, she is the UN independent expert on the enjoyment of all human rights for older people. The floor is yours.
Thank you so much. Ladies and gentlemen, it is an honor for me to be part of this expert panel and share my reflections on access to long-term care for older persons. First, allow me to warmly thank the organizers, UNECE and the government of Italy, for inviting me today to contribute to this important discussion on long-term care, to which I would like to offer a human rights perspective. As the UN independent expert on the enjoyment of all human rights by older persons. We already heard very good examples from the Netherlands and the very passionate impact on the dignity of older persons in Italy, so thank you so much. It's hard to concur here, but I also realized that it's really in line with what I want to present to you today, because the dignity is the center of the long-term care-centered approach. So thank you so much for already mentioning these kind of issues. Today, we gather within the context of the fourth review and appraisal cycle of the Madrid International Plan of Action and Aging. MIPA became, in 2002, the global aspirational policy document on aging, aiming at responding to the opportunities and challenges of population aging in the 21st century. While MIPA is not a human rights document, it contains a number of references relevant to human rights and adopts a conceptual approach that is in accordance with the human rights principles. However, MIPA, along with the current international human rights frameworks, have shown their limitations, especially in the face of the recent global challenges, especially the COVID-19 pandemic. Since I started my tenure as independent expert in April 2020, in the beginning of the pandemic, I have stressed on several occasions that the lack of a comprehensive international legal instrument dedicated to the promotion and protection of the rights of older persons has significant implications. The absence of an inclusion and recognition of age, discrimination and ageism in the current human rights framework has the most impact on the lives of older persons. As we know, the impact of COVID-19 pandemic has been horrifying for millions of older persons, especially those in need of long-term care. In many countries of the UNECE regions, evidence shows that more than 40% of the COVID-19 related deaths have been linked to the long-term care facilities, which figure being as high as 80% in some high-income countries. Cases of neglect and abuse in institutions and care facilities were also on the rise, as well as the overall increase in age discrimination and ageist attitudes, leading to trauma and stigma. The COVID-19 pandemic demonstrated that current legal provisions are not enough to ensure the dignity of people of all ages. In the face of new challenges, while the population continues to age older, policies and laws related to health and social support systems need to be adapted to the new and growing needs of our societies. Older persons are one of the most heterogeneous groups in the current framework. The rising demand for long-term care will lead to increasing costs for social protection systems and families. This needs to be combined with actions to ensure adequate access to high-quality care and support for formal and informal carers. This complex equation further needs to integrate concrete actions by states to end abuse, violence, and discrimination against older persons, especially while they receive long-term care. There is not yet an accepted universal definition on the term care or long-term care. However, the United Nations Committee on Economic, Social, and Cultural Rights reminds us in its General Comment number 14 that it is important to adopt an integrated approach, combining elements of preventive, curative, and rehabilitation health treatment. It is therefore essential that long-term care should encompass a wide range of services and assistance for older persons who require help with daily tasks and who need medical and social care on a continual basis. Such services include home care, private residence care, and private public institutional care. According to the United Nations Principles for Older Persons, adopted by the General Assembly in 1991, older persons should be able to enjoy human rights and fundamental freedoms when residing in any shelter, care, or treatment facility, including full respect for their dignity, beliefs, needs, and privacy, and for the right to make decisions about their care and the quality of their lives. To make real decisions, one really needs to be informed. So I always say decisions are only valid if there was real informed decision-making. States must adjust their current social and health policies to the needs of older persons, including services that consider gender and disability. Older persons must be recognized as rights holders and should be able to exercise their rights in all circumstances. A human rights-based approach for older persons in long-term care, particularly when applied in social and healthcare systems, will enable us to combine efforts and therefore maximize the benefits available to older persons. It will also increase the human rights protection for older persons in long-term care. It is important to prevent older persons from becoming dependent on long-term care. To do so, states should promote active and healthy aging, foster age-friendly environments, protect autonomy and active participation in all aspects of societies. States should also improve detection of an early identification of disease, especially for dementia. Access to healthcare service should be also provided and improved for those living in rural and remote areas. Habilitation and rehabilitation services and programs should be also reinforced to maintain maximum independence and autonomy of older persons. The translation of all these measures into a comprehensive international legal framework would contribute to prevent or delay the need for long-term care. Older persons have a lot to contribute to our societies. I thank you so much for your attention.
Claudia, thank you so much for drawing attention to the need really of having the human rights approach. And obviously there is no time, but we've been intrigued to know what it will take to have this sort of international instrument. It seems something that it's a no-brainer. We need to have it. So what is blocking us from getting there? That would be more from the discussion, I guess, afterwards. But can I move on now to the civil society representative? And I'm very delighted to have Maria Patklova with us, which is the director of the Tulip Foundations of Bulgaria. Please give your perspective on these issues. Thank you very much.
Let me start by saying that you all agree that we live in a dynamic times and a dynamic world. And if we still have the ability to somehow predict and to plan the future, it has been an achievement of the humanity over the last tens of years. Because many people mentioned the pandemic, and we now have war in Europe. And 2.5 years ago, none of us could ever think that we'd have such a devastating pandemic, and none of us would think that we'll be witnessing war on the television, like seeing live, how people are being killed. And the pandemic, if you remember us 2 years ago, the pandemic came suddenly and served as a trigger So it silenced cities and people, and when sitting in silence and isolated in our places, I think many of us trying to realize what is happening and where do we go from here, I think we also realize that it's not just the pandemic. There have been so many other changes over the last 20 years, but these are kind of gradual changes, one by one. And they're changes in the technology, and communication, and artificial intelligence. So even the way people communicate between themselves have changed. And still, there was one thing that hasn't changed, and this is human nature. People are the same. People have the same needs. And we have seen, there's kind of a wave across the continent and other continents of solidarity and people thinking of other people and trying to support other people. And we also realized something that we knew in the past. Families are a safety net. Communities are a safety net. And this is what most people need. And as this is the panel on long-term care, let me start by saying long-term care is not a policy, it's not a strategy, it's not even a service, it's not a job. Long-term care is any other care, is a relationship between two people or two sides of people. And relationship, we know this professionally and also personally, is not an easy thing. It takes time, needs attention, understanding, a lot of times patience. It's even more difficult because relationships are hard to regulate, to evaluate, to structure, to plan. Also because relationships are changing as people are changing. Third point, when we speak about different generations, and I'm happy Monsignor already mentioned, the 4 floors, and that's exactly the reality in Europe. Currently, we have 4 different generations living, learning, and working together. They're very different, but we still link between ourselves. And these are more or less the same people. It's not, when talking about long-term care, there's not one group of people who are stuck in one care and all of us, the others, we go around. No, this is changing. Some people come and people leave. It is just that the roles of people are changing. Every one of us, every single one of us has been a receiver of care, at least in the first years of our lives. Most of us, probably everyone, may at some point become a giver of care to someone else. Sometimes this is expected, it is planned, sometimes it just happens, and we're there for other people. And that brings me to my next point. Care is a continuum, and it should be addressed and should be understood and should be planned as such. When talking about long-term services and support, we need to know, and we actually know that these are extremely diverse services because people are different. They're different by age, they're different by needs, they're different by the location where they need. And that brings me also to the point of who the carers are. We speak of care receivers and caregivers, and these are professional caregivers and informal caregivers, but let's admit that behind these terms, there are live people. I happen to be a representative of what is called in Europe the sandwich generation. That is a generation that for a number of years, we had our parents alive, and then we had our children, and we had our grandchildren, and we had to somehow, pay attention to all these 3 other generations while having our own careers and caring about our own lives. I'm not saying that is easy, but that is crucially important. Maybe I could also, there's one other thing I wanted really to stress. When we speak about care, and especially long-term care, let's be aware it's not a goal. Care is just a tool. It's just an instrument for economic and social independence and inclusion of people, for dignified life, for participation, for people living together. And because the instruments are much easier to change, to adapt, to develop. When we speak about care, I really believe, we should think about possible ways to improve, to change, to adapt, as far as we keep the goal of long-term care being keep people socially and economically included into the society. Because care is not about food and bed. Food is about, care is about people having choice, people having human connection with other people, people who are valued. Let me mention just a few things that have proven how to be working. Yeah. One thing is bring agencies, different organizations together. As they say, if we wait for others, it's going to be too late. If we try to do things alone, it's going to be too little. So one thing is bring people and bring agencies together. And across Europe, there are plenty of models, there are plenty of approaches that have been studied, evaluated, and have proved to be effective in bringing 4 different generations together, in bringing people together, in making the link in between what is needed and who is able to provide which part of the combined support for any of us.
Thank you, Maria. I'm sorry we have so little time, because what you're saying is so fundamental, the issues of using really the pandemic as a trigger for change, thinking about relationship, not really about long-term care. And this shift really in the approach that we have, that we must really put together. Last but not least, over to you. And I'm very, very delighted, Stacey, to be introducing you. You are the director of AeroCare. So we've not talked much about family care, so a little bit, but could you tell us more?
I will, with pleasure. Thanks a million, Madam Chair, for your kind introduction, and good afternoon, everyone. It's a true honor for me to be part of this panel. Indeed, family carers have only been mentioned here and there since the beginning of this event, and I'll do my best to shed light on the situation and needs, because I think it is extremely important to do something about the situation needs of carers and develop new policy measures to support them. I'll try and build on some of the points that were made earlier. First of all, the fact that informal carers are actually the backbone of long-term care across Europe. That's a fact. According to EU research, as much as 80% of all long-term care in Europe is actually provided by family members, friends and neighbors, unpaid, usually outside of a professional context, with usually extremely limited support. The value of that informal care is so high that it is virtually impossible to replace, at least in the foreseeable future, by care professionals. So whether we like it or not, informal care is there to stay, and without carers, our systems would collapse. The problem is, in many cases, as I said, those carers have access to either extremely limited support or no support at all. And as a result, they face a long list of challenges. Very often, and again, during this conference, every time we mentioned some of these challenges, we focused on their ability to access the labor market and work-life balance. It is obviously extremely important, but it is not sufficient to focus on that aspect. First of all, because not all carers in Europe are of working age. We need to focus on young carers, kids, teenagers, and older carers, so people who are retired or unemployed, because these carers also deserve attention and support. And because the reality of informal care is that informal care, again, as I said, when not adequately supported, impacts on many dimensions of the daily life of carers. In terms of health, mental and physical health outcomes, in terms of social poverty, and social exclusion, and in terms of people's ability actually to maintain an active and dignified life. So whenever we discuss long-term care and the future of long-term care in Europe, we must pay attention to informal carers. Now, I wanted to at least showcase a few examples, recent examples of policy developments that we would consider promising or positive. I could mention, for example, the recent introduction of a national law in Portugal to finally legally recognize the situation of informal carers. And that was introduced in 2019, but we are yet to see a follow-up to that national law. Italy, around the same time, the Senate introduced a budget law to set aside a budget to support carers, but there again, we are waiting to see, the next steps of that initiative. I was very pleased to hear that Monsignor is working on a framework law to focus on active and healthy aging, but informal carers were not mentioned at all there, so I hope informal carers will be somehow captured, and I hope they are consulted as well, just like all the other relevant actors in the long-term care sector, many of whom are in this room. I could also mention the fact that my country, Belgium, just like France, which probably has one of the most inclusive definitions of informal care, or Germany have recently introduced measures to support the work-life balance of carers, or the fact that the Czech Republic introduced cash benefits to support the financial health of informal carers. That's all very good and very promising. But I must confess that from our perspective, trying to pinpoint any specific policy as particularly positive, relevant, or innovative is always a bit of a challenge. It amounts to having to show the most beautiful brush stroke on an unfinished painting. What really matters is the bigger picture, and that painting, as I said, is still unfinished. Now, we can turn to some very, I think, promising or very good approaches in several countries, which also have been mentioned since the beginning of the conference. I'm thinking, for example, of Scotland or the Irish models, which very much approach informal carers as part of the care, the fabric of the care system, and therefore seek to enable informal care and support informal carers, not only with work-life balance measures, but a portfolio of measures for social protection and social welfare, focusing on health and well-being, on pension credits, on access to carers' leave, on access to respite care, for example. The Finnish and Danish models are also very interesting. It is possible there for an informal carer to be employed by their municipality and therefore to have access to several rights but also obligations. Yesterday we commemorated the World Elder Abuse. It is important to mention that when there is abuse in the relationship between the care recipient and the informal carer, it's often as a result of a lack of information and training or excessive stress and pressure on the side of informal carers. So supporting informal carers with information and training can certainly help improve the situation there. I would also mention the very interesting ongoing policy dialogue that's taking place in Spain at the moment under the leadership of the Ministry of Equality and the National Institute of Women, so with a strong feminist voice included in the discussion, because again, as was mentioned earlier, I'm only pushing at an open door, the majority of informal carers in Europe are women. And that policy dialogue aims to let's say, review the policy ecosystem and foster gender equality across the board in Spain. And they are looking in particular at the care sector and care responsibilities, including informal care. And I think it's extremely innovative because the two main goals are to obviously ensure that everyone has equal access to care, but also that everyone has the right to provide care, provided that they are willing to do so, and they are able to choose also to what extent they want to be involved in the provision of care. Obviously, there's a strong element of a redistribution of care responsibilities between families and the state, but also between men and women. And that's another aspect that was not really discussed yet, at least since the beginning of this event. The fact that we all know we probably also need to encourage more men to take on caregiving responsibilities. And there are policy measures that could be taken to do that in the form, for example, of paid care leaves or a review of some fiscal policies. I'll stop there, but I'm obviously very happy to answer any questions you may have, and thanks again for your invitation.
Stacey, thank you so much. Unfortunately, we don't have time for a question. We have been cut short because of starting a bit late. But I like very much what you said. You know, there have been some changes, and you have mentioned some specific countries, but that has been not enough. And I'd love you're saying, can we encourage men to have a bigger part in all of this? So what I take home, I mean, obviously there are a lot of good examples. There's been some nice things that are happening. What is happening in Italy, the reforms in the Netherlands, some of the examples that have been mentioned. But at the same time, COVID-19 has revealed that we are very much behind really achieving the goal that we want all to have. And so if not now, when? I think there is really a responsibility for all of us to push very much this agenda with a human rights perspective, with the perspective of making sure that we look for the whole of society, intergovernmental approach, learning from some of the good examples, but really trying to push the agenda. With that, I apologize there is no time for more questions and discussion, but look forward to hear in the informal conversations what you have to say as well. And thank you very much, and a round of applause again for the speakers. Thank you.
Thank you, Monsignore.
Thank you.
It was
Yeah, it's a bit of a pity. Too many people behind the table, maybe.
Welcome back, those that have been respecting our break. Let's hope other colleagues will join us on this slow move of recovery. And allow me to make one recommendation. Apparently there were some difficulties with the sound. So our suggestion is that you could use, for a better understanding and listening what is happening, to use the headsets on channel 0, which is a channel for the original language. So it's much better for every one of us to hear what's going on the podium. That's just a recommendation. And thank you for coming back for this third expert panel. After the two first ones, we had this morning and in the afternoon. And this one is dedicated to the mainstreaming of aging to advance a society for all ages. This is a long-lasting driver for us, I would say from the beginning of the MIPA process, the importance of mainstreaming, and now apparently we have been able to give some steps forward regarding the question of mainstreaming. And the importance of mainstreaming that the Ministerial Declaration, the draft Ministerial Declaration tomorrow also welcomes in a more detailed way. The importance of mainstreaming is, in the end, because we should systematically integrate aging across all policy fields. This is something that should be a priority for all of us and some of the main driver for our action. This means, of course, because we cannot address properly the question of aging societies and persons and the challenges of older persons if we just focus on pensions, labor markets, or health and care systems. We have to go much beyond and try to go through all policy fields at all levels, national, regional, local levels. And this comes from the fact that today population aging impacts all aspects of society, and it concerns all age groups across the life course. We have been listening through all these conferences yesterday and today, the importance of this approach, and of course, the essential need to have this reflected in the different policy areas. That's why we have to put in place methods and mechanisms of gathering and analyzing the data and information we need, advocating across sectors and generations for a society for all ages. And we have seen this afternoon what's happening in different countries and the challenges that we are facing in this effort to coordinate efforts and to foster productive collaboration between all stakeholders. Those are two main pillars of this work, the question of coordination and the question of participation and collaboration. So, without further delay, it's time to hear our panelists, and I would like to thank them for their availability and their commitment to this topic. And so I would start by asking Minister Mary Butler, Minister of State for Mental Health and Older People of Ireland. Minister, the floor is yours, please.
Thank you very much. Good afternoon, everybody. And as Minister for Mental Health and Older People in Ireland, I'm honoured to speak to you today about Ireland's whole of government and whole of society approach to mainstreaming ageing. For the last 2 decades, Ireland has invested heavily in establishing robust policies and strategies across government departments and provided support to relevant local and national organisations. Our efforts have been internationally recognised. In 2019, Ireland was the first country in the world to be fully affiliated to the World Health Organisation's Global Age-Friendly Programme. We take our position and our responsibility in this regard very seriously. We are constantly engaging with citizens to ensure we are meeting their needs and the needs of our diverse older cohort. Over the last decade, over 20,000 older people have participated in consultations across Ireland, town hall meetings, roundtable discussions, focus groups, workshops and annual general meetings. Ireland's current programme for government has a vision of creating an age-friendly Ireland, where the voice and the choice of older people is heard, is recognised, but most importantly, it is listened to. Including older people in the core framework for policy and service delivery across government ensures that ageing is not just a health issue, but requires a whole-of-government approach to address a range of social, economic and environmental factors that affect the lives of our ageing citizens. Some quick examples are the Adult Literacy for Life strategy, which was launched in 2021, has now a simple vision to create an Ireland where every adult has the necessary literacy, numeracy and digital literacy to fully engage in society and realise their full potential. The strategy sets out to make people more aware of the services, to increase uptake of existing capacity, to expand the range of provision and to target resources on those who need it most. Older adults have been identified as a potential vulnerable cohort and will benefit from targeted funding. In 2010, our National Police Force on Garda Síochána launched the first Garda Síochána Older Person Strategy. The strategy has been updated this year to incorporate lessons learned from supporting older people during the COVID-19 pandemic, and it would also reflect additional elements identified through focus group engagement. Additionally, this year the Department of Education has established an interdepartmental policy group on lifelong guidance. The work of this group will ensure that lifelong guidance remains accessible and inclusive and a central element of the education system to foster lifelong learning. To ensure policies and strategies translate into meaningful outcomes, my own department has invested time and resources establishing and maintaining partnerships with local authorities and organisations such as Age Friendly Ireland. I recently launched Healthy Age Friendly Ireland Homes Programme, a partnership between the Department of Health, local government and Age Friendly Ireland. The aim of this programme is to reduce the admission rate of people entering into long-term residential care due to their living environments not supporting their health and well-being needs. The programme carries out assessment of older people in their homes. Assessments are based on 4 criteria: housing issues, healthcare, community and social supports, and technology to age in place. Age Friendly Ireland also coordinates the National Age Friendly Cities and Counties programme. There is an age friendly programme in each local authority in Ireland, all 31 of them. The programmes work to provide walkable streets, transportation options, age-friendly car parking spaces, access to key services and opportunities for older people to participate in community activities. An important element of the age-friendly programmes is the consistent engagement with older people within the community to identify local needs. Each programme has Older Persons Council. The councils are an important mix of key actors: the local councils, the health service, the Garda Síochána, NGOs, businesses and third-level sector representatives. Together they plan, they streamline their work, they identify the interests and needs of older people in their area. All of these age-friendly strands are creating environments that support older people's active participation in their communities. I believe Ireland has made great progress in preparing for an ageing population, but we are experiencing challenges. To guarantee the sustainability of long-term care systems, a qualified workforce is a key component. Ireland has experienced workforce challenges in the healthcare settings. The Department of Health has recently established a cross-departmental strategic workforce advisory group, and the role of the group is to facilitate the views of stakeholders and examine workforce challenges in relation to home support and nursing homes. Areas under consideration include recruitment, retention, training, career development, and the sustainable employment of home care workers in the future. The group is committed to delivering a set of recommendations to me by this September. Competing agendas across the Irish Government can also pose a challenge. However, there is another way to approach this. There is a very strong alignment between the age-friendly and climate action agendas. Both are seeking to develop a sustainable community in the context of the parallel megatrends of population and climate change. Across government, we have worked hard to highlight this cross-section climate and older persons. The Department of the Environment, Climate and Communication supports the Warmer Home Scheme through sustainable energy. This complements many of the age-friendly programmes and Ireland's policy statement on housing options for our older population. Changing the narrative from competing to complementing ensures both agendas, climate and older persons progress through and efforts are streamlined across government. Overall, Ireland is fully committed to mainstreaming ageing and the ultimate objective to make Ireland a great place to grow old. We have all achieved a lot, but there is more to do. Creating a society for all ages that leaves no one behind requires policymakers to understand the diverse and the evolving needs across the life course and along individual ageing trajectories. If we design housing for older people, we design housing for all. If we do not consider the needs of our older person, our housing design and strategies are leaving many down. We must continue to work in partnership and pay particular attention to the needs of more marginalised, vulnerable, hard to reach and minority groups of older people. Only with this in mind can we fulfil the commitments of the Madrid International Plan of Action on Ageing and support the achievement of the United Nations 2030 Agenda and the World Health Organization Decade of Ageing. And to conclude, we must always remember older people are an opportunity. They are never a burden. Thank you.
Thank you so much, Minister Mary Butler, for your committed and ambitious program and work. Thank you so much for your inspiration. Now it's time to give the floor to the Associate Deputy Minister of Employment and Social Development of Canada. This is Annette Gibbons. Please, the floor is yours. Thank you so much, Minister.
Thank you very much for that kind introduction. Distinguished attendees and colleagues, I want to just start by thanking the Government of Italy, UNECE, and the Standing Working Group on Aging for organizing this conference. I'm just delighted to attend and hear the tremendous expertise in the room. As we recover, all of us recover from the pandemic, this is such a wonderful opportunity to take stock of what we've learned and plan strategically for implementing MIPA going forward based on those lessons learned. But of course, also the topic of this particular panel this afternoon, how do we mainstream aging in all policy fields? It really is past time that we do that, as we all have a growing population of older persons in our countries. And, you know, giving the impacts that has, the integration of aging into health, social, and economic policies is really, really important. And in doing that, I just want to say at the start that it's really important that we make sure that we don't see older persons as a homogeneous group. There's a lot of different factors in the population of older persons that differentiates them, and it's really important to take things such as gender, culture, health, socioeconomic status into account, making sure that we don't leave people behind. So I'm going to focus most of my remarks on a particular mechanism that the Government of Canada has introduced to mainstream aging in the development of policies and programs in Canada. It's called the Gender-Based Analysis Tool. So as the name suggests, this tool originated to integrate a gender lens into our policy development. So basically to consider how people of different genders would experience policies and programs as they're being developed. We wanted to really do a detailed analysis of those different experiences, and then whatever we learned, tailor the development of the policy or program to reflect the differences in experience. So that's how the tool started, focusing on gender. But about 10 years ago, we expanded it, and that's why we now call it Gender-Based Analysis Plus. So the plus includes a lot of different things, including different demographic groups, including older persons, but also considering different factors among different demographic groups or within different demographic groups, such as education, socioeconomic status, and so on. So not only has the scope of the GBA Plus tool expanded over time to cover more demographic groups, but also the scope expanded to consider more factors that differentiate people so that we can be more targeted. But our use of the tool has also really expanded. For the last 5 years, it is mandatory whenever a department of the federal government develops a new policy or program, they have to have a gender-based analysis plus included in the proposal that comes forward. They cannot proceed to review by our cabinet committee and our cabinet, our ministers, without that piece. In 2018, our parliament actually passed the Canadian Gender Budgeting Act, which enshrines the application of GBA Plus in all new budget measures, tax expenditures, and existing expenditures. So simply put, this means that every policy, program, or initiative has to be looked at from an age lens, from the outside, bringing it to the particular population of older persons. Considerations need to be given on how a proposed initiative may positively or negatively affect older persons. And if there are negative effects, there have to be mitigation strategies or changes to the proposal to ensure it's inclusive of older persons. I'll be really frank, I read a lot of these analyses because I see a lot of what goes to our cabinet, and I am involved in the development of policy and programs. And this, to be honest, it's a work in progress. I would say it's getting a lot better. We do, though, have very high expectations, and you will routinely see the analyses sent back for further elaboration, for more data. In my department, I would say employment and social development, we're pretty good at it. We've got a lot of data. We're very strong on evidence-based policymaking. And we do, I think, pretty solid analyses of this type, but we're looking to improve further. So this is a really important tool that we have for mainstreaming aging in Canada, I would say, and we look forward to improving it with time. Before I close, I'll just spend a moment on a couple of other things we do to mainstream aging with respect to collaboration and engagement. So of course, we're a federation with provincial subnational governments. We have a forum of ministers, of federal and provincial territorial ministers, who routinely meet and work on issues to ensure that the needs of older persons are considered in broader policies. They work on things like housing, for example, for our senior population, social isolation, solutions to that. We also established an external advisory body, the National Seniors Council, and they look at policies and programs and do research, provide advice to the government on things that the government needs to do, and that includes mainstreaming aging. So these are just a couple of things that Canada is doing, and look forward to hearing from other panelists. Thank you.
Thank you, Minister, for illustrating that beyond the fact that it's needed, it's possible to mainstream aging across all different sectors. Thank you so much for your magnificent example. Now it's time to give the floor to the Minister of the Canton of Jura, which is at the same time President of the Swiss Conference of the Cantonal Ministers of Social Affairs, Mrs. Nathalie Barthelot. Please take the floor.
Mesdames et messieurs, en vos fonctions et titres respectifs, le gouvernement fédéral suisse a publié en 2007 une stratégie en matière de politique de la vieillesse portant sur 5 thèmes: la santé et les soins, le logement et la mobilité, le travail et la transition vers la retraite, la situation économique et enfin l'engagement et la participation sociale. Son objectif était de contribuer à ce que l'avancée en âge soit prise en compte dans tous les domaines politiques. Bien qu'il ne soit pas contraignant, ce document a marqué un tournant. Fortement imprégné par l'idée du mainstreaming, il a aidé à faire émerger une acceptation plus large de la politique de la vieillesse, à rompre avec l'image de la vieillesse fondée sur des déficits, à imposer l'idée qu'il faut tenir compte de la diversité des parcours individuels ainsi que des ressources et des potentiels des personnes âgées. Évidemment, pour un regard d'aujourd'hui, la stratégie de 2007 comporte des lacunes, notamment à propos de la question de la pauvreté et de la dimension de genre chez les personnes âgées. Par ailleurs, son impact est encore difficile à mesurer, faute d'indicateurs pertinents. Mais les cantons suisses, en charge d'une grande partie de la politique de la vieillesse, ne sont pas restés inactifs. Plusieurs cantons ont développé des concepts et des politiques vieillesse au niveau cantonal. Et un autre bon exemple est celui d'une trentaine de villes suisses qui se sont rassemblées sous l'égide d'un réseau intitulé « Villes amies des aînés » pour développer des projets intégratifs sur toute une palette de thèmes et placer le vieillissement à l'agenda politique des villes. Grâce aux instruments de planification, mais aussi grâce à des approches informelles rassemblant des acteurs clés, on peut débattre différemment des enjeux politiques. Premièrement, la constitution d'une prévoyance vieillesse pour répondre aux besoins d'une population hétérogène. Deuxièmement, la mise en place de soins de longue durée dans le respect de l'autonomie individuelle. Et troisièmement, la promotion d'une conciliation entre vie professionnelle et vie familiale, respectant en particulier le droit des femmes. Ces 3 champs d'action sont ceux de la plupart des pays de la région Europe. Afin d'éviter de passer à côté de l'avis des principaux concernés, il s'agit ainsi d'adapter une approche qui passe par la co-construction et la participation des parties prenantes. J'aimerais signaler ici un instrument à première vue modeste que nous utilisons pour répondre aux besoins d'autodétermination qui animent chacune et chacun dans l'avancée en âge. C'est le subventionnement d'organismes agissant concrètement pour encourager la personne âgée à conserver son autonomie à l'aide de formations ou de campagnes, en sensibilisant les personnes elles-mêmes et leurs proches. Il est essentiel de pouvoir continuer à exprimer ses choix jusqu'au bout de la vie, y compris quand des soins importants sont nécessaires. Par exemple, certaines institutions d'hébergement de longue durée notamment expérimentent de nouveaux modes d'accompagnement en s'inspirant, à titre exemplatif, de la méthode Montessori. Comme ministre, j'aimerais conclure en remerciant celles et ceux qui nous aident à rester proches de la réalité. Les chercheurs engagés sur le terrain, les organisations de la société civile en contact avec les personnes âgées, les professionnels et enfin, et surtout, devrais-je dire, les personnes intéressées elles-mêmes. Et comme le dirait le dessinateur belge Philippe Geluck, être vieux, c'est être jeune depuis plus longtemps que les autres. Merci pour votre attention.
Minister, for this example of participation and collaboration that is those are 2 of the main pillars of the mainstreaming, and we will have the opportunity tomorrow to go further on this topic, but thank you so much for your example. Now it's time to go to our researcher, independent expert researcher, coming from the School of Social Work at Bar Ilan University in Israel, and professor at this university. Please, Mrs. Layat Avalon. Thank you so much.
Good afternoon, and thank you for the opportunity to be here, and also thank you for sharing with us excellent examples of mainstreaming aging. As you said, I'm a researcher, which means that I'm being paid for being critical and for asking questions. And I would say that even though there are excellent examples of mainstreaming aging, to the most part, we have not done enough, and aging is not mainstream. Instead, ageism is mainstreamed, and this is probably a main reason why aging is not mainstreamed. Ageism is defined as stereotypes, prejudice, and discrimination towards people because of their age. It is manifested in the way we think, feel, and act towards people of any age group, and it can be either positive or negative. However, I will argue here today that it is the negative social construction of old age which prevents us from mainstreaming aging. Ageism is prevalent at all levels. It is prevalent at the institutional level, and we have seen many examples during the pandemic of how rules and regulations discriminate people based on their chronological age. We've seen it pretty much all over the world with differential lockdown, exit, triage, and even vaccination strategies in some part of the world that differentiated different groups in the population simply because of their chronological age. This has resulted in the unwarranted death of older people, in the violation of human rights of older people, and in the prevention from older people of accessing goods and services. We have seen during the pandemic also examples of how ageism is manifested at the interpersonal level, in the way we interact with each other. And there has been quite a prevalent portrayal of older people as vulnerable and a burden to society. The problem with these messages is that they penetrate our own mindset, and they feed into the way we think of ourselves and our own age and aging process. Research has shown that those individuals who think more negatively about their own aging are more likely to die earlier, are more likely to be functionally impaired, and have worse health and mental health. So the way we think about our own aging is extremely important. As was already mentioned here today, ageism is extremely prevalent. In fact, it's more prevalent than the other big isms, sexism and racism. 1 in 2 people in the world reports being ageist, 1 in 3 reports exposure to ageism. It is really prevalent in all aspects of our lives. As researchers, we all many times fail to collect data, disaggregated data, based on age. And again, we've seen that during the pandemic, especially during the first waves. Even though we kind of knew that age was a major issue, many countries have failed to collect death-related data by age and illness-related data by age. We also do that in terms of the terms we use, the terminology we use to refer to older people and to the current demographic changes that we are experiencing. We use terms such as the aging tsunami, the problem of aging, the challenge of aging, the elderly, dementia patients. All of these terms, again, are quite belittling, they're derogatory, and they penetrate our own mindset and our own thinking about our own aging process. Since we're short in time, I will give only one example of how I think aging should be mainstreamed. Apparently in some countries like Ireland, it is being mainstreamed, but many other places it is not. And that's the area of climate change. And we know that older people are considered to be one of the most susceptible groups in the population to the negative effects of climate change. Nonetheless, if we listen to discourse, to policy discourse around issues of climate change, there is a lot of times a blame game and tension between the generations, with older people being blamed for failing to act, for leaving a substantial carbon footprint behind. And if we look at policies, older people many times are neglected from climate change policies, despite the fact that they represent one of the most susceptible groups. I will argue here that it's not their physiological susceptibility, but it is the social, economic, and political environment that fails to acknowledge the challenges that this population experiences and fails to protect them during severe climate change events. We know that there are a couple of effective interventions that can be used to tackle ageism, and I hope that I managed to convince you that we should all work hard to tackle ageism. And the World Health Organization has identified a couple of interventions that have evidence-based. The first one is intergenerational contact. Our entire life is divided by chronological age. This really results in the notion of us versus them. We really need to bring people together of different generations to work together, to live together, and this really requires an entire shift in our mind as to what life course we actually want to have. But once we bring people of different generations together, they're going to work together and there's going to be intergenerational solidarity. A second strategy that has evidence-based is education. And we know that through education about the effects of ageism, we can really influence people and change the way they think, feel, and act towards others. However, I will say that in many countries, people are not even aware of the term ageism in its national translation, and many countries don't even have a national translation to the term. Our own research has shown that once we familiar people with the term ageism, they're more likely to acknowledge, yes, I experienced ageism. This means that if we do a good job and tell people what ageism is, we're actually going to see a surge in reports of ageism. A third strategy that does not have enough evidence, but is often used, is actually social campaigns. And it's very important when we use social campaigns to actually portray a diverse image of older people. We do not want to err to the other side and say that all older people are successful agers, and that's the contra that we give to negative ageism. Because as we have been talking today and yesterday, aging is a diverse experience and people experience it in different ways. So we really don't want to bring a one-sided image of what it's like to be an older person. It's also important that when we're using social campaign, we do not rely only on digital technology, which is relatively easy and cheap, because again, we're going to exclude certain parts of the population if we do that. And it is important to accompany social campaign by research, to actually develop an evidence-based research around that. The fourth and last strategy is legal interventions. And we've heard this call over and over in the past 2 days for a UN Convention for the Rights of Older People. I think we absolutely need this tool so that it will serve as a reminder to us as nations, societies, individuals. What does it mean to discriminate people because of their age? I don't think we're there yet. I think we really need very, very explicit and clear guidelines if we really want to mainstream aging at some point. Thank you.
Thank you so much for your challenging intervention and reminding us that we have to be much more dedicated from going from words and proclamations to actions. And so thank you so much, and highlighting some of the strategies that could be adopted to combat ageism, which is in the end preventing us from moving forward in terms of mainstreaming. So thank you so much. And finally, we have between the panelists, of course, we have the country director for Help Age International Moldova, Mrs. Tatiana Sorokan. Please give us your views.
Thank you, the Chair. Good afternoon, esteemed participants and distinguished guests of this extraordinary forum to review implementation of Madrid International Plan of Action on Aging, or otherwise MIPA Plus 20, as we refer to it shortly. I would like to also acknowledge for my participation in this forum the UNECE, but also the government of Moldova and the UNFPA office in Moldova. And also thank you, Italian government, for hosting all the participants, but also myself, in this wonderful city, Rome. I am going to speak about mainstreaming aging into public policies from a practical perspective, because as a representative of HelpAge International organization, which is an international NGO, but also has other offices and partners around the world. Our mission is rights-based. We are rights-based organizations. That's why we're looking into protection and promotion of the rights of all the people so that they live secure, dignified, and healthy lives. And therefore, our mission in every country starts with analyzing legal frameworks, and based on legal frameworks, see what we can do, what we can change for all the people. It just happened back in 2014-15 that we have looked into the local legislation existing in Moldova, and we have found out that we have the law on the mechanism for public policy consultation, and then with civil society. And also we have the law on information from 2000, and then the law on participatory decision making from 2008. Also in 2015, by 2015, according to international commitments that Moldovan government has made, in 2012, the government adopted the roadmap for mainstreaming aging, and then HelpAge participated with a delegation of all the people in the consultation for development of this first roadmap. In 2014, the government adopted the national program and plan on mainstreaming aging, and then in 2015, HelpAge, together with the government of Moldova, the Ministry of Labor and Social Protection, funded by the UNFPA, developed the National Platform on Active Aging, which is a network of many NGOs working to protect the rights of older people. And then in 2015, the UNFPA, through their consultancy that we outsourced jointly, developed the first mainstreaming aging methodology and trained civil society organization, key government servants to apply this mainstreaming aging methodology. And we were, in a way, the first organization that tried to apply the methodology together with the platform on active aging, and we looked into a number of policies that are related to older people and aging. And I remember that we discussed within the platform on active aging, what is the first policy that we're going to analyze? And they suggested, of course, health. So we looked into non-communicable diseases, strategy on non-communicable diseases. But then we said, why don't we take something, if we speak about health, take and analyze how the policy on physical education and sport reflects older people, and whether it is inclusive of older people. And when we called the ministry, the relevant ministry, and told them that we want to analyze the strategy, the first question that they said, why? This is not for older people, this is for youth. You shouldn't be part of this. You are working with older people, how come you want to analyze our strategy? And so we understood that there is a lot of work to do here, and then we started, and by 2020, we have analyzed over 50 different policies, national policies, plans, and strategies, and came up with recommendations for the government of Moldova to include older people better. And some of the successes I can speak about is one of the successes, the adoption, 62% of the recommendations that the National Platform on Active Aging and HelpAge International provided to the government were included for Moldova 20 plan. And then for the National Action Plan on Human Rights, over 40% of our recommendations were included in the plan, which means that gradually during the 5 to 7 years, they started acknowledging the need for inclusion of the needs of older people and also started accepting our recommendations. And today, I'm very proud to say that the government of Moldova is very open to this process, and through the government, we also receive direct requests to the HelpAge International and the Platform on Active Aging to analyze a particular policy and come up with a recommendation on behalf of all the people and aging. For us, mainstreaming aging also is important because this is a participatory process, and we, as an organization that is working with all the people, are looking into integration of voices of all the people. We listen to what all the people say, we work in the communities, we work on the ground, and then we bring the evidence from the ground to inform policy development and policy review. It is, of course, a difficult process because it depends at what level of implementation a certain policy is. For example, if you get to a design stage of the policy and come with recommendation to a particular area of policy development, then that is probably the most successful way, because at that point, more recommendations are required from the civil society and HelpAge and the platform, but also they are more forthcoming, rather than a policy in implementation, because you cannot stop it and change it very quickly. There is a whole process that the government needs to undertake to be able to review a certain policy. But even this is possible through review of the action plans for the strategy, because you can review the indicators, different institutions involved in implementation of certain activity, and etc. We have also found out that from our perspective, to be able to integrate the needs of all the people better in the policies, we need a more committed unit within the government level in Moldova to do mainstreaming aging. Currently, there are several issues that impede or are barriers to this integration of the needs of all the people. First of all, there is only one service on demographic policies within the Ministry of Labor and Social Protection, and 2 people that work there, only 2 people, which they are doing extraordinary work, but there is not sufficient staffing. With a population in Moldova where currently every 5th person in Moldova is an older person, we believe that there is need for at least a whole department on aging. And there is need to create a coordination group for mainstreaming aging into all public policies, and also mainstreaming aging into community or local level policies, not only national level policies. We also believe that this coordination is very important between the ministries, between the ministry departments, interministerial coordination, so that it is not the duty of only a focal point on aging to do mainstreaming aging into public policies. It's a huge undertaking, and it requires resources, human resources, but also financial resources and commitment. We are open for this, and we are glad that we are a like-minded, let's say, organization with the vision of the government, and we believe that the government will listen, will hear our recommendations, and will commit more to mainstreaming aging into public policies, because we don't need policies on paper, we need them implemented, and we need more people involved for this. I'll stop here in the interest of time.
Thank you, Mrs. Tatiana Sorokan, for your experience in mainly the impact that you have put on coordination efforts and the question of participation. Those are, as mentioned several times, very, very important pillars of this work. Thank you so much. And I would like to thank all the panelists, because we have, they have been so disciplined in terms of schedule. We have time for your comments, for your questions, if any, for your reflections. So it's also a privilege that we can have a number of minutes to go further. Please. Yes. No, it's not working, the microphone. I don't think so.
I think it is.
Thank you very much.
No, but it doesn't work with the, no.
One question.
You need to.
Sorry, because otherwise the interpretation will not be possible. That's the, sorry.
Maybe she takes off the headphones. Yeah.
No, it doesn't work, apparently. Help is on the way, sorry.
Technician.
We take someone else while we're waiting. Oh no, here we have one.
That's a marathon.
This one?
I tried this one. Yes, it
no,
works.
that's
Thanks.
good.
Thank you for the excellent presentations. And one remark struck me that was about the effectiveness of intergenerational contacts in the fight against ageism. I was just wondering, are there good examples how to translate it in practical activities? Let me give one example from the Netherlands. What we have in a number of new projects is that we combine the living in nursing homes by the clients at a certain age in combination with students living in the same nursing home. So that then actually they volunteer also in the nursing home. They go to cinema, they prepare food, or they have talks. So that's an interesting example of how we can actually promote the intergenerational discussions. But I guess there are many more good examples, and I'm looking for them. So maybe you could have some suggestions for me. Thank you.
Thank you. Before going back to our panelists, please take the floor.
Yeah, thank you very much. I used the same microphone. Yes, I am a participant here in this meeting. My name is Philip Hammerroth. I'm coming from Finland, the retired in Finland. Well, in the panel you have underlined the importance of having different parts of society involved so that this could be successful. And I agree with you that all should be involved and engaged and so. And there one could at the same time say that there is still a reluctance in, how to say, accepting the constructive input by different parts of groups of society. For instance, older people. A kind of reluctance still. But my question is, would it be right to interpret also the old people as an asset to society? Because they are an asset. We know that it is a growing asset. So my question to the panelists is, how do you interpret and take the older groups, people in this sense, so that they can be involved and positively involved and requested to be involved? Thank you very much.
Thank you. Any other question or comment, reflection? Yes, please. Russia Federation.
Thank you very much. This is the first time that I heard about the specific implication of the climate change to the elderly people. So in this case, may I ask you to provide us a concrete example, only one or two, yes, from the speakers, about the concrete implications, because this is a very important moment, and I think this is the issue that we need to address too. Thank you.
Oh, thank you. If there are no other questions from the audience, maybe I can go back to our panelists, and I'm sure they all have comments to make on these topics that have been raised. So please, Minister Mary Butler, could you start?
I can indeed. Thank you very much for the three questions, and they were very interesting. So the first question from the gentleman on the left was in relation to intergenerational and some examples in relation to that. And I thought during COVID, we saw huge examples of intergenerational supports in my country, Ireland. There was a call out from the government called Community Call, where local sports groups, local organisations, working with the local authorities, the local councils and the police force came together to support older people who were cocooning at that particular time. So they would collect the shopping, they would go to the local pharmacist, and they engaged. But what I also believe is hugely important for intergenerational is Meals on Wheels. So it's a situation where meals are delivered to older people every day. And it's much more than a nutritious meal. It's the actual contact that somebody is actually calling during the day to that person. If they're not there, they may not be unwell. It's really, really important. And just a third example is I recently visited a daycare centre in Cork. It's a county in Ireland 2 weeks ago. And there is an engagement with transition year students. So these students are not doing it, they're not in an exam year. And what they do is they engage with the older people. So it's a daycare centre, but there's also people who live. So the students come, they engage with them. They show them how to do technological supports if they're not used to computers. And they also fundraise for them at Christmas and provide them with gifts. So I do think it's really, really important. And when you involve young people engaging with older people, it will go a long way to end the stigma. In relation to the other question about climate change, it was the lady down there, you spoke about climate change. And what we have done in Ireland is what we're trying to do, we're trying to move as quickly as possible to climate change, but we must have a just transition. So we've many older people living in rural parts of the country where they are dependent on fossil fuels to heat their homes. So it's very important that in relation to those people who are in fuel poverty, that they can afford to transition. And we have put a lot of funding this year into that. We also support older people through what we call a fuel allowance. And we have 375,000 people out of a population of 5,000 people receiving fuel allowance 26 weeks of the year. And this year we increased it by 40%, and it now stands at €1,200 per year to support people who are challenged in relation to fuel poverty. And I suppose the other question was, how can older people be seen as an asset to society? Well, as I said earlier, I always see older people as an opportunity. I never see older people as a burden. And the amount of lived experience that older people can provide to us on a daily basis, older people built our country, and they have so much to give back. And I'll go back to the point I made earlier, and it's something I remember every day of my life as Minister for Mental Health and Older People. The voice and choice of older people must be heard, it must be recognised, but it must be listened to. And they have so much to offer, and they have so much to give. And that is the only way we can prevent ageism, by recognising and listening to our older people. So thank you.
Thank you, Minister. Now I'll give the floor to Minister Annette Gibbons, please. Your comments, if any, on this question.
Sure. I won't comment on everything. Just on the intergenerational, I think there's a gravitation to think about youth, and I think that maybe other countries are ahead of Canada in thinking about that particular connection between youth and older people, and congregate living, for example, students living in nursing homes, which I just think is just a fantastic example of creativity that really fills a need for both the students and the older persons. But I would say that we are thinking more and more about ensuring that the social isolation and the sort of the in-home supports that people need to stay in their homes. We are thinking more and more about that in the Canadian federal government, and We have different programs that aim to counter social isolation, and they will leverage volunteers of all different ages to get out and do activities with older persons. We're also about to, well, we've launched now and start funding a program of pilots, experiments, if you will, on ensuring that seniors have support to stay in their homes. We have many local community organizations that are doing really interesting things with meal delivery and you know, driving people to appointments and so on, snow removal. And we want to fund more of that to allow those organizations to have a broader reach than they currently have. So that's an interesting thing that we're starting now in earnest, and we'll look to see the results and probably tweak it with time in future iterations. Thank you.
Thank you, Minister. Now it's the turn for Minister Nathalie Bartoulou, please, if you have any comments.
Oui, peut-être un bref commentaire par rapport à ce qui a été indiqué. C'est vrai que la nécessité du contact intergénérationnel est évidente aujourd'hui et puis qu'on doit mettre en œuvre toutes les possibilités pour le favoriser. Peut-être deux exemples dans mon canton. On a fait des constructions aujourd'hui où on mixe les générations, c'est-à-dire que par exemple on construit des immeubles où il y a des appartements protégés, adaptés pour les personnes âgées. Et puis par exemple le rez-de-chaussée est dédié à une crèche qui accueille des enfants et on voit que finalement tout le monde s'enrichit au contact les uns des autres. Puis peut-être aussi un autre exemple, je dirais, de contact intergénérationnel. Il y a un programme qui a été lancé en Suisse où on permet à des aînés de retourner dans des classes d'école pour des enfants en très bas âge. Et puis, finalement, ces personnes accompagnent l'enseignante qui, voilà, pour certaines tâches, sont là, aident. Et puis, on voit qu'il y a une relation qui se crée entre les enfants et la personne plus âgée qui est dans la classe, qui est très intéressante, très positive. Et on voit que ces enfants prennent vraiment conscience des différences de génération, du potentiel et puis de tout ce qu'il y a de bien à retirer d'une personne qui a déjà une certaine expérience de vie.
Merci. And now it's your turn, please.
Sure. So I think that with regard to intergenerational contact, it's very important that we don't go back to the situation of caregiver, care recipient. We want to keep both parties as equal. So we really have to identify opportunities for both sides to contribute, but also get back. And the example of a nursing home would be a great one with children. I think in the workforce, we could see that as well. We could also see that in certain games where older people might have a superiority in terms of knowledge with regard to certain things, whereas younger people might have knowledge with regard to contemporary popular music. So I think it's really important to keep both sides on equal terms when we're trying to establish intergenerational contact. With regard to the second comment about older people as an asset, I think that we live in a neoliberal economy, and we value people based on the money they produce. And I would say here that many countries have mandatory retirement age that immediately cuts older people from being productive and being seen as an asset. But obviously, it's not only a financial asset. And older people have the wisdom, have the experience. They're oftentimes taking the caregiver role, which is unpaid, yet is extremely financial and is extremely beneficial to us as a society. So we really need to acknowledge the contribution that older people make in the present, but also, as was stated here, also their past contributions. Last, with regard to climate change, I think that, well, we are in Italy now. Every year during the summer, there are thousands and sometimes 10,000s and more of people who die, and it's a lot of times, many times, the majority of time, older people who die. And it's not only older people. It's going to be older people who are socially isolated, who are poor. It's going to be more likely to be women. So there are certain intersections here that we have to identify. And I think that policies really have to acknowledge that and target those particular parts of the population that need extra education about using air condition, maybe extra help to access air condition. But this is really the minimal, and there are many other things that we could do with regard to that issue.
Thank you.
Thank you. Tatiana, please.
Thank you. If I can also add on intergenerational approaches, because Moldova is a country with a very high level of migrants, economically active population working abroad and leaving children behind. Despite the fact that we want to see all the people being active socially, they do have a caring role, and a number of older people take care of the grandchildren when their children are away, and they love doing it. And not only Moldova, if we take the Ukrainian country and the current situation with the refugees that come to Moldova, over 68% of refugees come with children. All the people, refugees, come with children. And when we asked them about their future after the crisis, they said that I want to be at home taking care of my grandchildren. So we need not disregard this, because it's one of the important but also enjoyed roles of all the people. But we also need to give them an opportunity for social contact, for social connectedness. And I agree that it should be a fulfilling role on both sides. In terms of fulfilling role, we have an example of our project with the UNFPA and with the Mobile Operator Company, Mobile Foundation, on the younger generation, teaching all the people how to use mobile phones. And we have posters in the lobby where you can read more about this project, but it is a very rewarding experience when a younger generation teaches all the people how to use the phones. And we have a number of case studies and stories and pictures of all the women speaking for the first time on a smart mobile phone with their family, and hearing the voice and seeing the picture and being petrified by this. And it's very, very touching indeed. In terms of all the people as an asset, I completely agree. We need to look into this because, for example, at HelpAge International, as I mentioned in the beginning, it is important for us to listen to the voice of all the people, because they tell us about their needs, and they are the experts of life, and their own lives, but also their peers. And one of the comments and phrases of the former UN residents I've heard, and I read actually, so that the irony of all the people is that they are excluded from the society that they themselves helped to build. So this is indeed something that we, through our policies on aging, on mainstreaming aging, should aim to include as much as possible these needs of all the people, because they have once done this for other generations. And we need not to neglect them, but really consider all the people as an asset. Their voice, their needs, their experience, their wisdom, and their knowledge, because not all the people are the same. They're not homogeneous. They're a very diverse group. Everybody has a lot of interesting experience, and we value also this at HelpAge, as with other organizations in this panel. And I hope you will appreciate and will follow these examples as well. So thank you.
We have noticed one request for a comment, I imagine. Please. We have a microphone there, right?
Yes, thank you, Chairman.
It's done.
I am working in civil society, and I will put one thing to the audience, that in many cases we see the elderly as actors of person of the past, and I think it's very important to recognize the elderly as also actors, political actors in the present. And I give one example. For instance, in my country, in the Flemish Parliament, we have only 6 members of Parliament over all parties on 124 members of Parliament who are older than 60 years old. I think that we need also to change how we see elderly. Elderly are not only the constructors of the past, but we are also actors in the present. And I think it's very important that we try to do it in politics. And when we are talking about intergenerational solidarity, it's very important to have also, but over the generations, debates on what politics is. I think when we're talking about peace now, I come from the old peace movement, and I look to the problems now. I think that we as older generation, we have something to set, and I think it's very important talking about intergenerational solidarity. We should recognize the elder generations as actors in the present. It's the younger generation has already fight for it. When I was young, I had to fight to be an actor. I was seen as something for the future. We were fighting to become actors in the past. I think that the elderly have now to fight to become actors in the present. Thank you.
Thank you. I don't think that's a question. It's a comment and an alert, I would say, to all of us. Let's take the example of President Biden, I would say, is quite well involved with almost 80. But thank you so much for your comment and for your alert. Well, I think we've come to an end from our panel. It's time to give the floor to Kai Larsenring, which went through the three different panels very attentively and will try to give us the main highlights for what happened this morning and this afternoon. So please, Kai, thank you so much for your work, and allow us to get home these main messages.
Quickly.
Thank you so much. Thank you, Kai.
Yeah, thank you very much, Edmundo, and thank you for inviting me to wrap up, which is really a difficult task after all this we have learned today. Excellencies, colleagues, friends, how do I address you? First thing I've learned, I should address you all as co-agers, because this is really something that is completely uniting us. Everybody aged during that day also, and we are aging together during these challenging times where we have seen, many conflicts also, and inequalities, inequities. And at the same time, I'm very happy that we are here together in an international setting, because this is what we need most, I think, dialogue and international cooperation on learning together, in this case on aging, but there are so many other challenges at the moment that often this has been put a bit in the back of the agenda, and I hope that, but I see with this event that it will come up again. And as a policy analyst, I like to compare and to analyze based on assumptions, and I would like to compare a bit let's say the MIPA process from 20 years to now, and how I saw this discussion today, focused on these three issues. So on promoting active and healthy aging throughout life, I've observed a shift of attention regarding active and healthy aging compared to, let's say, 20 years ago, where then following the Madrid conference, it was mainly active aging was then focusing a lot on extending working life. And as we are in Italy, excuse me if I bring some criticism here. We have seen in Italy a moment where pensioners, or where people over 60 learned from one day to the other they had to work 5 years longer now. And this is, of course, something that should not happen again. And I saw this also both in the in the declaration, which will be discussed tomorrow also, but also during this day, that there is now more understanding that it is not the only, we cannot only put pressure on the individuals to extend working lives and to take responsibility, but there is much more talk about facilitating, safeguarding, putting together the social tissue and social responsibilities towards older people, but also towards citizens across the life course. Regarding the topic of promoting active and healthy aging, regarding the topic of long-term care, which is already one step ahead. Also in the original concept of active and healthy aging, long-term care and the need for care was mentioned in a second part, but this was then often forgotten. And the fact alone that long-term care now is one of the key one of the three key issues of this declaration shows us, of course, also with the help of the wake-up call that the pandemic, of course, gave us, that there is now an understanding and an awareness that that long-term care will be one of the key challenges, in particular regarding the fact that this is still mainly unpaid work and still mainly done by women. So the move towards more integrated, person-centered care and the support of informal carers will be, of course, an important step in our efforts. Regarding the third issue, mainstreaming aging, we see a kind of a revival of a term that was already part also of the MIPA since its very beginning, but also here we see more this re-strengthening stakeholder involvement, the whole of society approach, integrated policies and so on, involving all stakeholders. So my general hypothesis for and also synthesis of this day is that we are, and it was also mentioned in several contributions, the term paradigm shift. We see a certain paradigm shift from we have lived an era of neoliberal and individualistic ego governance for a long time. Also, not only in aging policies, but in many policies. But when it comes to aging policies, of course, then it is important to develop this type of governance. And we saw, not only in this last panel, but also in the others, a shift towards more involvement, workshops, you name it, all types of advisory boards, the attempt to involve citizens as citizens, be they older or not. At best, they should not be chosen based on their age, on their chronological age, but on their openness to contribute to an eco-social system of developing aging policies in a network within countries, but also on the international level. And I could go now through all the sessions where this was under this general assumption and synthesis was empirically shown by a number of contributions that and also that now is really the time for immediate action on aging, for taking the wake-up call also of the pandemic seriously. This might be done by developing laws or legal frameworks, by addressing the new fragilities that also came up through the pandemic, but also now through the war. We are all, I think, we are all very sad to have, to experience that there is a war so close to us and in our region, and that this has, and this also affects older persons. So older persons want this new paradigm and this shift, and older persons, this is me. This is you and this is us, and we were also reminded of that today, and this is very important. We want to decide for ourselves. We want, of course, individual choices, but we want to adapt these individual choices and streamline or bring them together with other generations with whom we live together. It was mentioned we are 4 generations. Sometimes I think we are even 5 generations currently living together. And we want to think about living together and to face the challenges that are ahead of us, not only in terms of aging, but all around up to climate change and you name it. That can only be done by an intergenerational effort, and this I saw, or I felt during this day, that there is now a chance to get there, and I hope you agree with me that this should be also followed tomorrow in the ministerial ministerial segment, that we develop together this kind of eco-social networking on the improvement of aging policies together. Thank you.
Well, thank you, Kai, for your report on this rich day that we had. And it's time to thank, of course, the rapporteur for his summary, first place, then the moderator of the different panels, and especially, of course, all the panelists that have helped us during these magnificent conferences. So, also a very special and warm welcome to all of you that have been with us, to the participants this afternoon, and to the interpreters that helped us also in a not always easy task. Thank you so much. And just before giving the floor to Lydia for some announcements, I would just like to remind you that we have a dinner foreseen at 8 o'clock this evening at the restaurant of the Hotel Le Quattro Stagioni. So, if not before, we'll meet at 8 o'clock at the hotel restaurant. Thank you so much for your attention and participation, and enjoy a beautiful evening. Lydia, please.
Thank you very much. Thank you, Chair. I think we have had an interesting day. I conclude it as successful, and we will all deserve a glass or two later tonight. But before that, dear colleagues, several delegations have been asking us for a list of registered heads of delegations. We have 46 delegations. We have produced such a list, and those who are interested can collect such a list as of tomorrow morning. It will be placed on this table where the Secretariat colleagues are sitting. This is my first announcement. My second one is that to remind you that tomorrow we'll start at 9 o'clock, not 9:30 as today. We start at 9 o'clock tomorrow, sharp, with the opening of the ministerial segment, which will include several official addresses. And this will be followed by 2 roundtable discussions. Please take note that tomorrow morning, before you join your seats, the Secretariat in the morning will distribute to all delegations a draft declaration with any small adjustments, if any, because the declaration, as was mentioned this morning at least twice, went through 2 rounds of consultations. However, there are small things that have to be fixed, and actually in 40-50 minutes, the Bureau, chaired by Edmundo, we are meeting at 6:30, the Bureau of the Standing Working Group on Aging, to review and decide on the final formulation of these small adjustments. This is to say that if any adjustments to any paragraph, this will be printed on a separate paper and will be also distributed next to your draft declaration. And at this point, you'll have until lunch, and it will be announced again tomorrow, to view, review, and if any editorial or whatever comments you may have, you have to make them in writing and submit them to the Secretariat. With this, dear Chair, we are all looking to the restaurant. Thank you.
Thank you, Lydia. Thank you so much. And Geraldine, thank you so much.
Thank you very much. Thank you.
Thank you.